Now, we discussed about rheumatic heart disease. Now, let us look at rheumatic disease now in ecological appearance. How does the echo appears when the patient has a rheumatic heart disease? Because echocardiogram is the most commonly used form of diagnosis to confirm rheumatic valvular disease. So it strengthens the history and the clinical examination of the patient. So at this point, let us look at the ecological features of rheumatic heart disease. You remember that rheumatic heart disease starts from beta hemolytic streptococcal affecting the throat, resulting to rheumatic fever, which affects various connective tissues in the body, and then the valve, the heart valve body can be destroyed. The most common we have seen that it's aortic valve and the mitral valves. Now, grossly, let us look at the normal and gross anatomy. You can see the mitral tricuspid valve. You can see the mitral valve. Tricuspid valve is on the right part of the heart, which allows the blood flow from right ventricle, the right atrium to the right ventricle. The mitral valve is the one which controls blood from the left atrium to the left ventricle. Yes, that is how they are. You can see them there now, both in diastolic and systolic. In diastolic, the tricuspid valve is closed. The mitral valve is open. In systolic phase, the mitral valve is open, systolic, and then the aortic valve is closed. Now, the normal mitral valve in diastolic and systolic in a echo perspective. In a systolic, the heart, the mitral valve is closed. You can see the mitral valve there. This is a apical four-chamber view. You can look at the apical four-chamber view, or even five-chamber view. So you can see that there. You can see it is closed. You can see it is well closed. This left atrium, the anterior mitral valve. You can see the anterior mitral valve, the posterior mitral valve. Okay. Now they are open in diastolic phase. This is how they look more. Anterior mitral valve reflect, posterior mitral valve reflect, aortic outflow, aortic outflow, and then the right ventricle. Right ventricle. That is how it appears in this case now. Now, the complications of rheumatic fever, if it is not treated, it can lead to chronic valvular heart disease, which we call it rheumatic heart disease. The most affected is mitral valve, which can result to mitral stenosis or mitral regurgitations, or aortic stenosis or aortic regurgitations. These ones can result to heart failure. Now, this is how mitral valve appears in echo. Ideally, a mitral valve appears like the mouth face. This is how it looks like. You can see that this one is narrow. The mouth is not open here. The mouth is not open here. And the velocities, if you measure the velocities, you can see that there is no flow. There is restricted flow of blood down around the mitral valve. On the mitral valve, there is restricted flow around this area in terms of velocities. We will look at velocities later on. So the mitral stenosis, you can see that the normal heart, how it is, but mitral stenosis, you can see that the yellow part here, it is stenosed. That is, it is stenosed. There is also small amount of blood to come in. See here in mitral regurgitations, there is flow of blood backwards. When you use Doppler, to check whether there is mitral regurgitations. You can see the blood is flowing back. And it's flowing back. So in aortic stenosis, you can see the valves, the steno of the stenosis of the mitral valves here, stenosed. It is stenosed. This is the normal aortic valve. It looks like a Mercedes Benz appearance. The stenosed, then in the systolic and the diastolic, it is opened. Yeah, it is not fully opened. It is closed in that case. So you have to be able to check these things in the echo. So the normal valves operations, the aortic valve, that is how it occurs in the aortic regurgitation. But you can see that if it is leaking, it is allowing the blood to flow back again. It's flowing back blood again to the left ventricle, allowing the blood to flow back again. It's allowing the blood to flow back again to the ventricle, which results to insufficient blood to the body. So that is how the appearance of the effect of rheumatic heart disease appears in echo. Ideally, also there is other areas like endocarditis, pancreatitis, how they look appear in echo. We'll look them later on because they are a product of rheumatic heart disease. Thank you very much.